Hello and welcome to the session. I'm pleased to be the moderator for today. As you can see on the slide, a number of partners, co-sponsors, supporters, and journal partners of the conference have made this session and others possible, so we're grateful for their support. Next slide. So today's session is on the topic of ethics and regulatory dimensions of digital innovation to enhance health systems. And I'm pleased to be joined by 4 or 5 colleagues who will be sharing their work with everyone today, and we'll have an opportunity to hear their presentations, and then we'll have some discussion following them. Next slide. So let me briefly introduce myself. As the moderator for today's session, my name is Joseph Ali. I'm an assistant professor in the Johns Hopkins Bloomberg School of Public Health in the Department of International Health and the Health Systems program. I'm also a core faculty member and associate director for global programs at the Johns Hopkins Berman Institute of Bioethics in the United States. Much of my own work focuses on ethics and regulatory issues involving global digital health. So just briefly, by way of orientation to the platform that we're using for today's session, there are a few tips on the screen, as you can see. First, there's a support chat button that you'll see in the upper right corner, which you can use to access chat support during any time during the session, if you face any technical issues with your connection or with the platform itself. There's also a Q&A module on the right-hand side where we'll be asking you to enter any questions or comments that you have at any point during the session. And we'll field those questions and discuss them with the group following the presentations. You're welcome to type your questions in there if you have them at any point. For best experience, the conference organizers recommend that you view the session in full screen. You see an opportunity to do that by clicking on the button. As a reminder, the sessions will be recorded and they'll be available to view the next day and will remain available until the 31st of March, 2021. It's also recommended that you adjust your browser zoom ratio to 67% and play the session again in full screen by selecting the enlarge icon on the top right of the session window. Great. So let me go ahead and begin our formal substantive portion of the session by welcoming our first speaker, Jamiro Mpima. Jamiro will be presenting on factors to consider before implementation of digital health innovations, a case of Kamaroja subregion in Uganda. Jamiro is the technical coordinator for the Last Mile Health organization in Uganda. He's a health informatics leader, the MSc, in the clinical background as well, and has participated in various e-health initiatives, particularly development and implementation of digital health global goods, both nationally and globally. He comes to share experiences and practical lessons learned on how digital technologies are strengthening performance of health systems. Thank you, Jamiro, for joining us. And we will be hearing Jamiro's recorded presentation now, and then we'll have an opportunity to hear our other speakers. And then, as I said, we'll follow that with a bit of discussion. So.
Hello everyone, Jamiro Mpima from Uganda. I'm a health informatics specialist with a bias of digital health implementation and strategy development. I'm here to share a piece of work we did in Uganda about key considerations you need to know before implementing a digital health innovation. So just a little background, much of the fact that electronic medical record systems are being implemented in many parts of the country because they have shown great potential when it comes to improving health systems and health service delivery. However, overall adoption is still low. However, much of the investment and lots of resources have been utilized in these systems. So you find that even those systems that have tried to pick up, the utilization is still a little bit low. So this has been due to lack of several pre-implementation activities that are needed to be put in place to have the enabling environment. To that end, we carried out an e-health readiness assessment in the Karamoja region, which would help us later to prioritize investments to prepare for successful digital health initiatives. So we carried out a cross-sectional survey which took both quantitative and qualitative approaches to inquiry, and we visited 143 health facilities. Data collection tools were developed and also validated by various teams. So we talked to health workers, district representatives, Ministry of Health, and many other stakeholders in that regard. And of course, all other ethical research procedures were followed. So in our findings, we note that Karamoja as a region was ready for e-health from the great enthusiasm exhibited by health workers and district officials. However, there are certain key challenges that need to be addressed to ensure successful implementation of these initiatives. And notably among is that, there is lack of stable electricity. Most of the facilities are running on solar and those are small panels to just run the fridge for vaccines. There is no stable internet connectivity in most of these health facilities. Hardware is very, very limited, and in most places it wasn't even existing, that even some of the health workers didn't have phones. There was, of course, majority of the health workers didn't have even basic ICT training, that some of them can't even use a smartphone. So that was a big challenge. And of course, staff attrition came up as also a big challenge, that when you train health workers this year, you'll need to train more next year because many of them have switched jobs or have left their positions. And of course, attitude. Some of the health workers were not very enthusiastic about digital health. I remember one health worker told us that, okay, instead of increasing our salaries, you are busy buying for us computers. So that is a big challenge that needs to be solved. Data security was another that needed to be looked into due to the fact that data needs to be available whenever it is needed, and also of good quality despite these other challenges. And of course, management guiding documents when it comes to digital health are still lacking, especially at district level. We all know that Uganda has an e-health strategy, but some guiding documents and are not trickling down to the district in that regard. And of course, that leads to no or less limited budgeting when it comes to digital health at district and health facility level. So from the study, we propose a framework that would help us in having the enabling environment set for these implementations for digital health and electronic medical records to run smoothly. And it is segregated into inputs, processes, outputs, and of course, which would lead us to the overall impact and value for these digital health solutions. So the inputs would be divided into organizational factors, technical factors, and change management factors. The organizational factors are to do with the whole policy governance and the resource mobilization to bring together the enabling environment. The technical factors are those to do with the infrastructure, the software, the hardware, electricity, internet, and those factors to make sure that they're in place. And change management are to do with training, attitudes, and so many of those factors to make sure that we have buy-in at all levels of the health system. And the processes we would use to make sure that all these inputs are together, we need to do a lot of advocacy, capacity strengthening, training, development of materials for training, and of course, we need to engage lots of stakeholders, right from the community to the national and international levels to support the health systems. And of course, with that, would have improved and a very successful rollout of these e-health services, such as electronic medical records, improved data quality, and of course, the data that would be generated from these electronic medical records would support decision-making at all levels so that we have improved population health outcomes, therefore later on achieving the sustainable development goals. And along the chain, we need to learn and continuously do monitoring and evaluation. So this study was led by Ministry of Health Uganda with support from World Food Program and funding from DFID. Thank you so much. I welcome any questions, comments that may arise. Thank you very much.
Thank you, Jamiru. See, my video stopped, so I'm unable to start it again, but perhaps the conference organizers can work on that while we're, I'm introducing our next speaker. Our next speaker is Yara Abelwafa. Yara is presenting today on digital health ecosystems in Egypt, overview of the current state, challenges and opportunities. Yara is a co-founder of Health 2.0 Egypt in UAE. She's a global health professional who caught the technology bug, as she says, and has since been focused on intersection between technology and healthcare. Her professional focus lies around healthcare innovation, digital health, and public-private partnerships in healthcare. We look forward to hearing Yara's presentation, and then we'll continue with the others. Thank you.
It's my pleasure to be presenting today the outcomes of our research on digital health innovation ecosystem in Egypt. Globally, health tech is transforming the face of healthcare with the use of technology, and Egyptian entrepreneurs are following the global trends and making strides towards improving health outcomes using innovative healthcare solutions with a sharp focus on 4 areas: improving the service delivery, payment, consumption, and administration of healthcare. So the objectives of this research is to map out the stakeholders in the field of digital health in Egypt, provide a snapshot of digital healthcare startups in Egypt, and outline the challenges and prospects. So what we've done is that we, in 2017, 18, 19, we've surveyed around 87 startups to understand the number of startups that are operating in the market, the levels and the types of investments that they're having, as well as their challenges and prospects. We've also conducted 5 roundtables with around 27 institutions spanning investors, healthcare providers, insurance, pharma, international organizations, so WHO, UNFPA, UNICEF, USAID, and the likes, to understand the ecosystem outlook on the potential needs, opportunities, as well as challenges in the digital health space. So first, we see that there are multiple stakeholders in the digital health innovation ecosystem that entrepreneurs need to work with to successfully deliver innovation in healthcare. More than in any other sector, successful delivery of healthcare innovations need widespread alliances and cooperations. For example, entrepreneurs will need to work with providers to reach customers, as it is hard to reach consumers directly. They will need to work with payers to launch pilots and work for potential reimbursements. Investors to get sufficient financing and bridge the sales cycles gap. And regulator to receive product market authorizations, as well as working with universities to further research opportunities and work with also the innovation support ecosystem or the innovation support hubs. So innovation in healthcare sector necessitates healthy collaboration between all of these stakeholders. It's almost impossible to do it alone within the healthcare space specifically. So looking at the digital health startups in the Egyptian market, there is almost 86 active startups that have collectively raised around $60 million. In the grand scheme of things, this is not a large amount of money, considering there has been $7.4 billion invested in 2019 in the digital health startups globally. And also we have to note that this number is highly skewed by one of the startups that has raised around 40 million. We see that almost half of the startups are still within the early stage, so prototype and recently launched. And this is due to the challenges that we will talk about in a while. As well as most of the startups tend to be on the service side of improving access while cutting costs. Most of the services provided are on-demand platform and marketplaces, self-diagnosis and disease management tools, and EMR. And there's yet to be startups in Egypt that focuses on deep tech and scientific innovations. And that's mostly because digital health in Egypt is so far mostly driven by convenience. We look at the market prospects in general, almost 80% of startups operating in the healthcare space believe that their company is moving forward steadily and hitting all the milestones. We see that this is mostly driven by 3 factors. There is an increased awareness among the ecosystem players on the importance of digital health solutions and the benefits it could offer, leading to more partnerships happening within this space, especially with the government sector and the pharmaceutical sector. This is also igniting the appetite for investment, So we see more angel investors looking in the healthcare space, as well as accelerators and incubators. And finally, there is higher adoption rate by consumers, specifically after COVID. Nevertheless, we're still only scratching the surface in terms of digital health innovation mature ecosystem. Across the board, all startups, regardless of their size, are struggling with access to capital. Startups in more mature stages also see that the lack of regulation is one of the main reasons that is stifling their growth. While recently launched startups see that market response and forming partnerships are the missing critical pieces. And we see different challenges across the board, regardless of the level of maturity of the startup. And this is mostly due to the presence of only ad hoc initiatives to support digital health innovation without a clear long-term roadmap to nurture the ecosystem. So in conclusion, we see that there are 4 stages of digital health ecosystem that needs to be present to have a flourishing environment. First and foremost, the early stage agnostic innovation support, which is usually consistent of competitions, events, accelerators, incubators, and these regard tech solutions regardless of the industry that they're working in. Next, there is the healthcare-focused innovation, and this is usually done by big pharma or hospital groups that work with the startups to scale up innovations and to focus their innovations to what do they actually need to deliver their products. And then we look at organizations that work with the digital health solutions to have a baseline understanding of evaluating these digital innovations and scaling these digital health technologies. And then finally, commercialization. So organizations that work with the digital health innovations to commercialize and increase their global reach. And this usually needs more cross-border collaboration. In Egypt, what we see is that we have a very strong base of early stage industry agnostic innovations, yet we still need to work on the next three stages. Within the next stage of healthcare-focused innovations, there has been more or less some initiatives within the past 2 years, yet not enough to support the amount of startups that we need and support the innovation that needs to be done within this space. So finally, for digital health solutions to realize its potential in Egypt, there need to be a focus on supporting innovations to build precedents and success stories. Success for the ecosystem will require a guiding national digital health strategy to align stakeholders and a coordination body to ensure building a coherent ecosystem and avoid falling into the traps that other countries and other ecosystems have been in. Thank you very much, and looking forward to your questions.
Thank you, Yara, for your presentation. Before I introduce our next speaker, I just want to remind attendees that you're welcome to write any questions or comments in the chat module there on the screen, and we welcome you to do so that we can have a rich discussion following the next 2 presentations. So our next speaker is Juliana Hagembe. And Juliana will be presenting on the promise of new technology and increasing access and reducing disparities in healthcare for cross-border and mobile populations. Juliana is a program associate with Duke Global Health and Innovation Center in Kenya. She is a global health specialist, is passionate about the use of innovative evidence-based methods to improve healthcare. In addition to having a master's degree in public health from the University of Hong Kong, she has a master's and bachelor's degree in biochemistry, both from Northern Michigan University. She currently works for the Innovations in Healthcare and the Duke Global Health Innovation Center, contributing towards scaling global impact in health innovations. So Juliana, we're looking forward to your presentation. Thank you.
Okay, so my name is Juliana Hagembe, and I'll be presenting work done on the under the Regional Action Through Data project, titled The Promise of New Technology Increasing Access and Reducing Disparities in Healthcare for Cross-Border Mobile Populations. So just a bit of background on the RAD project. The RAD project was born in a co-creation workshop hosted by USAID in 2016. The main goal of the project is to improve the use of data for regional and national health decision-making. And one of the sub-goals is to ensure continuity of care in cross-border settings for improved health outcomes through enhanced data use and innovative e-health technologies. So the project is a collaboration between 5 consortium partners, 2 regional economic communities, the West African Health Organization, which is part of ECOWAS, and IGAD, which is part of the eastern part of Africa. There are 3 technical partners, which is Broadreach, that looks at the regional level, basically trying to ensure that there's aggregate information from various sources at the regional level to inform decision making. Then there's Jembe Health Systems, which tries to ensure that there's appropriate data collected at the patient level. Then last of all, we have Duke Global Health Innovation Center that tries to look at the policy level and ensure that there's a conducive environment for data sharing, both at the regional and national level. So just a bit of background focusing on the IGAD side of the project. So one of the key priorities of IGAD is cross-mobile populations. The health needs are a key priority. However, lack of clearly defined health data related policies and data infrastructure in the region has been shown to lead to insufficient data and unreliable medical records, which has basically led to difficulty in healthcare providers being able to track cross-mobile populations from one country to another, which leads to compromised access to continuity of care and quality of care. So due to this, the cross-border populations have poor quality of life, which is a concern for IGAD. In addition, there is reduced, due to insufficient data and unreliable medical records, there is reduced ability of governments to be able to track health trends. For example, when there are outbreaks, it's almost impossible to properly plan and allocate resources effectively. So while mobile health tools and solutions can actually support the different countries in regards to data collection and data sharing across borders, one key issue that the countries face is a supportive regulatory and policy environment, which is needed for innovations to scale and create meaningful impact. So to find out exactly what policy-related challenges that affect data sharing and scaling of mHealth innovations, we as Duke University and IGAD undertook a landscape analysis, which consisted of a desk review of policies related to digital health, data sharing, immunization, disease outbreaks and surveillance, and also cross-border populations, migration, pastoralists, and other semi-nomadic communities. We also did key informant interviews with international and national district level stakeholders in Uganda and Kenya, and did some site visits at the cross-border areas to figure out and understand what the challenges are on the ground and what the practices are actually on the ground. We then use the information from the landscape analysis to select strategic approaches to address challenges to the creation of a regulatory environment that would allow scale up of mHealth innovations and ensure seamless cross-border health information exchange. Then using grid analysis, we selected what was the most strategic approach. So in regards to the results, from the policy landscape analysis, 3 major gaps were identified. The first one being there being a lack of legal or regulatory framework for data sharing. The next one being inconsistent standards and policies for data protection. And the last being inconsistent patient confidentiality and privacy laws. So the key issue here is this differing regulatory environment among the different countries actually hinders the development and deployment of innovative health solutions. For example, since innovators of health solutions have to customize their solutions to differing regulatory environments, they have to incur extra costs to meet the differing regulation environments, which actually hinders scaling of innovations from one country to another. In addition, some laws are just restrictive, for example, not allowing and storing of data outside borders. This actually hinders and restricts scaling of innovations. So as mentioned, we did do a grid analysis and strategic approaches to address gaps were identified and clustered into 3 main clusters: policy, technical guidelines, and a legal framework to actually address these gaps that were identified. And through the grid analysis exercise, which was undertaken with IGAD colleagues, the policy option was selected as the most strategic approach to standardize the data sharing environment in the IGAD region. And the reason why this was selected is because it is within IGAD's mandate and could be achieved within a reasonable time frame. So just in conclusion, and as a summary, after review of the challenges associated with data sharing and deployment and development of mHealth innovations, we did find that development of a regional data sharing and protection policy that is endorsed by IGAD member states could most effectively support implementation and adaptation of mHealth innovations. This is because of increased ease of providing health data related services by the private sector. Currently, a policy is currently being developed by IGAD with support from Duke. Yeah, thank you.
Thanks very much, Juliana. I'm now going to introduce our next presenter, who is joined by actually her colleague today, Marie Donaldson, who I'll also introduce. But the presentation you'll hear shortly is provided by Ashley Bennett, who is the former policy lead for health systems innovation and delivery at PATH in the US. Ms. Bennett has 15 years of work experience at the intersection of global health innovations and governance. At PATH, she led the recent development of the COVID-19 policy tracker with WHO, which examines essential health services, service adaptation during the pandemic. She previously led PATH's digital health governance and policy portfolio, where she designed the digital health governance arm of the Data Use Partnership, created global policy goods for Digital Square. She used her leadership roles with the Data Foundation team of the Joint Learning Network for UHC, the Transformation Health Coalition, and Digital Health and Interoperability Working Group. She's excited to learn and discuss how we can use the policy and technology to improve health equity in particular. So as I mentioned, Ashley will be presenting shortly on digital and data governance. How can we bridge the digital and data divide to accelerate the path to universal health coverage? She's joined by her colleague, Marie Donaldson. Next slide. Marie is the Associate Director for the Center for Immigrant, Refugee, and Global Health at the City University of New York School of Public Health and Health Policy in the US. Ms. Donaldson is currently conducting her PhD research on stakeholders' perceptions of data governance practices for national health management information systems. She's been a consultant for the WHO's Integrated Health Services, UHC Life Course program, and for its Information Evidence and Research, now Data Delivery for Impact program. She was a senior technical advisor to the USAID-funded Health Evaluation and Applied Research Development, or HERD project, and associate director of the Translating Research into Action project. Earlier in her career, she worked in Bolivia on reproductive health and gender activities, and she's graduated degrees in public health and public policy from Columbia University. So we'll now hear from from Ashley, and Marie will be taking questions during the Q&A session on this presentation. Thank you.
Hello, everyone, and thank you for joining our session today. My name is Ashley Bennett, and I work for PATH, where I am the policy lead for our Health Systems Innovation and Delivery group. And I'm delighted to be here to talk about the ethical and regulatory issues around digital innovation. So what we are addressing today is digital and data governance. How can we bridge the digital and data divide to accelerate the path to UHC? So one of the most timely topics in the area of governance right now is around the governance of innovation and data. We are now living in a time where we have a huge amount of data at our fingertips, as well as rapid innovation of the tools that collect and use it. So how can we harness that in the service of UHC? So if we look across the global landscape, we know that information is crucial to achieving health outcomes. It's crucial to aspects of healthcare like primary healthcare, which is a key driver of UHC. And in order to address inequity and improve service delivery, we have actually expanded the amount of data that we collect. And despite our technological innovation, our governance and policy systems have not kept pace with innovation. And so we are left in a situation where there's not always the ability of the health system to use the data that it has. And so how can we think about improving governance of data and governance of innovation to address that? And with the COVID-19 pandemic being frankly in its early stages, that has only heightened the urgent need for better governance of digital and data to support both the pandemic response and its very heavy data needs, and then also the maintenance of essential health services throughout the pandemic and improving those health services for the long run. So here we have a couple of use cases around digital and data governance. So these come up fairly frequently. One is around data sharing. As public and private partnerships are growing more creative, as new players come into the health space, we need to figure out how to share information among all these parties. So that might be different ministries and agencies that are becoming more involved in achieving health outcomes. It might be NGOs, it might be non-health entities like mobile network operators who hold a lot of data. So how do we share data among these different groups? And the second is the governance of national digital transformation. So many countries are at various stages in transforming their health systems and integrating digital tools, digitalizing their overall system so that they're able to have the right data at the right time when they need it, and they're able to use it. And often leaders in these situations are facing multiple competing needs, local outbreaks as well as routine healthcare services, donor partners that have competing priorities and additional expectations. So, how can the community rally around national leaders to help them ensure that digital transformation really meets their country's priorities and needs? So at the global level, we've seen leadership and governance growing in emphasis and focus. So this is the WHO ITU eHealth building blocks. You see leadership and governance is highlighted here. And although, there's excellent guidance at the global level, the question remains, what does that practically look like? How do we actually implement digital and data governance? And how can different countries and different players be involved in that? And so that was the question that we wanted to address with an investigative background paper that WHO and PATH and the City of University of New York developed late 2019. We were looking at lots of different opinions and approaches around governance. And we wanted to investigate that and really glean the trends in the utilization of digital and data governance in the service of UHC to see if we could align on a definition and sort of combine all the different frameworks that are out there and sort of discuss gaps that the global community might tackle together. And so a quick note on methods, we looked at several different types of documents, peer-reviewed literature, policy documents, gray literature reports, and we compared and contrasted these to synthesize our conclusions. And so one interesting thing that we noticed was that digital health governance and data governance were actually sort of two different sets of governance, and they had two different sets of components that comprised their definitions. And so historically, these fields have been separate, but what we realized through this work was really that digital and data are not operating separately. They are now part of one continuum, especially with our technological innovation that has advanced to the point we are at today. And so while you might see two sets of components here, what we realized that we needed a new definition and a new way of thinking about governance. And so the moniker Digital and Data Governance for Health really embodied all of that for those of us developing this paper. So it combines things like data standardization and data de-identification and controls like that with leadership platforms and governance structures like decision-making committees at the national level, policies and strategies. And so it's a more holistic view of how to use governance in the service of UHC. We also identified a few priorities for the community to work on together. And so there were some additional research areas around data privacy and security. There was additional guidance that was needed. Important also to what we are currently addressing with the COVID-19 pandemic was this data governance and data sharing issue, cross-border data transfer policies, sharing of data via the cloud mechanisms, things like that, and also an emphasis on improving equity and representation in large data sets that are used for innovations like machine learning. And so I wanted to leave you with these last two slides, just a reminder about the positive and additive aspects of digital and data governance for health. So it fosters equity, it produces global policy goods that can be used by all parties. The strengthening of privacy actually strengthens health systems, and that leads to better health outcomes and accelerates the path to UHC. And if we had a tagline for this work, this would probably be it, that digital and data governance ensures that digital innovation and the use of data benefits everyone, but digital data governance for health ensures that digital tools and data are sustainably harnessed to support UHC objectives. So I'm very much looking forward to this discussion, and thank you all for being here today.
Thank you, Ashley. So we now have quite a bit of time, which is great. One of the nice things about pre-recording sessions is that it leaves plenty of time for discussion. And I'll invite again attendees to please share any comments or questions in the chat box. While you're doing that, maybe I'll invite our panelists to perhaps turn on their video if they'd like, and we can have a brief chat about your presentations. I want to give our panelists also an opportunity to ask questions of each other, but maybe I'll start with an overall question that I would love to hear everyone's thoughts on if you're interested. So it sounds to me like there is, each of you, I think, to some extent touched on the kind of aspect of harmonization of policy and governance frameworks in some degree or another, either across portions of different sectors within a country or even across country borders. And as we know, there are a lot of different influences that can impact different aspects of society, whether it's political, cultural, normative, economic, these kinds of different incentives and disincentives that might play into the goal of harmonization and impact it in a way that makes it perhaps challenging to achieve. But I guess I have two questions. Maybe one is do you think harmonization of these policy and governance frameworks is the right goal to achieve sort of better and more sustainable digital health systems? That's question number one. Or is it perhaps more nuanced than that? Maybe harmonization is good in some circumstances or some aspects of policies, but not others. I don't know, but I'd be eager to hear your thoughts on that. And then the other aspect is perhaps if there is some aspect of harmonization that's beneficial to overall global policy development, what are some of the approaches and strategies that you see as being perhaps helpful in supporting that goal at a local level, given these differences and political differences, again, sort of cultural differences that may play into these elements? So I don't know if anybody would like to share, maybe based on your work or experience, but you're welcome to respond.
Hi, so I can maybe address the part of digital health policies or harmonization of policies with regards to the investment scene within the digital health startups and the adoption rate. So we see that the more digital health policies or digital health strategies or national strategies being specific with what digital health solutions that they want. One thing is that we see that solutions don't come up in a sporadic way, working on their own, addressing problems that are not necessarily the main national problems that we're looking at. And the other thing is that as soon as you have national strategies and digital health strategies, you start having providers moving a little bit more towards adoption, which increases the revenue cycles for the startups working in digital health, which also increases their scale, and it just follows on from there into a positive cycle.
Yeah, thanks. I think I agree. Within a context of a national system, that kind of framing makes sense to me. That there is perhaps a value in harmonization across different sectors to support sustainability and growth of that system. Do others have thoughts about maybe cross-border sort of harmonization of policy and some of the challenges or opportunities there?
Yeah, so just reflecting on the work we've been doing with IGAD in terms of coming up with a regional policy, with the main reason behind it is to ensure that there's harmonization of policies in the IGAD region. I strongly think that there is actually a benefit in it. From example from what I spoke about in my presentation, harmonization of policies creates a more conducive environment for different digital health platforms to scale and to be able to operate in different environments. And also, a key thing that that hasn't been brought up, that I didn't bring up, is when we're meeting with different stakeholders in the countries, in the different member states, one of the key benefits that member states actually brought up in why harmonization would be important through the leadership of IGAD is that since different countries that have different infrastructure, different levels of infrastructure, actually having the same policy or the same policy actually would encourage or help countries that are behind in creating in their infrastructure, in their infrastructure building, to actually the more developed countries would actually help the other countries grow and create a more even infrastructure to help not only data sharing, but even just innovations to actually grow and scale.
Thanks, Juliana. Yeah, I see there's as a comment here in the chat from Loveday, asking, is there a risk that harmonization is good for global players, but might mean that interventions don't meet local or national needs? So I don't know if anyone has had experience or heard from your informants about this kind of concern about balancing local and international needs. Marie, did you want to?
Yeah, can you all hear me?
Yes.
Okay, thank you. I just wanted to also talk about this harmonization issue. One of the things that we saw in our work was that, we're kind of looking at it from the global level and sort of how our countries sort of meant to report on certain things at a global scale from the WHO perspective. That there's a lot of actors, right? There's a ton of actors who are in this ecosystem, as one of our colleagues pointed out, and there's sort of a proliferation of data standards or data or indicators that donors or different kind of partners want. And there's maybe a lack of alignment with what is existing in the sort of national priorities. And so part of the work part of this paper was sort of to say, like, global harmonization is required, we think, to sort of agree on a set of principles around data governance. But then from there should certainly be it should be able to be adapted, these sort of governance pathways to local contexts and priorities and the health system. So I think that it's certainly true. I think that we've seen this kind of, I think the harmonization should address what this question is asking in the chat around sort of how do you get the goal of kind of global harmonization, but with the outcome being that there's more local and national needs are prioritized.
Thank you.
I think I also support, as someone who has practiced at both implementation level and at policy level, there is a tendency to take all the various countries to be at the same level as we try to look at harmonization, which is quite very wrong and brings about issues whereby many of the countries have developed some of these strategies basing on some kind of guidance globally, but then they fail to implement because they are different levels. And for example, if you look at data on one side and digital on another side, you find that data collection, majority of the health systems are still using a lot of paper-based. And so we need to grow the digital and the innovation side. But on one side, we also need to manage the data that is currently on the paper side. So customization on a case-by-case basis would be ideal as we look at providing guidance globally for harmonization. Thank you.
Thank you. Maybe building on that question, if we think more substantively about what these frameworks might look like, I wonder if you have thoughts on what principles, maybe regulatory principles or just maybe even ethical principles, are needed or are available currently to support, the development of responsible digital health ecosystems, either within a country or across countries. So sometimes it's helpful to think about these things in terms of broad principles, right? That should be guiding these policies. Have you seen or any principal frameworks that you think are useful to refer to for individuals who are interested in policy development, or do you have ideas about what sorts of guiding principles feel to be important in this space, either from a data protection perspective or from a sort of broader digital health governance perspective?
Since I've actually been in the process of developing a policy with IGAD, I can speak about the key principles that are articulated in the policy. So the first one is, the policy is in regards to data sharing and protection. It borrows from a lot of the policies in the region, including, and laws in the region, including the Kenyan data protection policy, the Uganda data protection policy. The African Union also has a policy on data protection, ECOWAS and SADC, and also the GDPR, obviously. So, the key principles include the principle of purpose and relevance, principle of legitimacy and consent, principles in regards to storage, confidentiality, and security, principles in regards to data transfer, principles in regards to access and accuracy, principles in regards to, and quality and transparency. So all of the principles are actually clearly articulated and explained. Similar, they are similar to the GDPR. I mean, they borrow from, because GDPR, I think, is right now one of the strongest data protection principles out there. It borrows a lot from the GDPR data protection principle.
Thank you. Jamir, maybe I'll ask you to and then I'll come to you, Marie. But Jamir, I wanted to ask you something you said, maybe that relates to this, is that I don't know if it's captured in Juliana's kind of high-level lay of the landscape of principles, but something that seemed to come through in your presentation was that on the ground, amongst the people who are actually implementing these activities, there's this sense that that investments are being placed in perhaps sometimes the wrong sort of are focusing on the wrong things, and that is like buying fancy computers and not paying our salaries, you said. So I'm just sort of thinking about, like, do those kinds of concerns, do you feel like they're being reflected in these policy frameworks in terms of these principles that are being articulated? And if not, how might they be?
Some of the policies and frameworks try to reflect some of that. I would call that trying to look at this in a systems thinking kind of approach, whereby we know that, okay, digital health can support health systems to grow, but we need to look at the health systems as a whole as we try to move the different bits and pieces of the health system as we all know them. Some of the principles actually I would mention would be health systems thinking, whereby we approach the harmonization of the policies and putting up these frameworks in having in mind the other bits and pieces, like, for example, human resources for health, financing, things to do with supplies and other things. Otherwise, we find that the decision makers who are the leaders in these health systems overwhelmed with lots of priorities, and you may find them not prioritizing some of the things because they feel, okay, it may be an additional cost, but we are not, because we are not probably informing them of how it would help them to reduce cost in another point or another particular piece of the health system. Yeah, so I think health systems thinking would be a big principle as we come up with these frameworks.
Marie, did you want to contribute here?
Yes, thank you. I think I just wanted to add to what my colleagues said about sort of existing principles. I think there is a lot out there in terms of data sharing guidance and things like this. I think one of the things that we've been looking at is really sort of this idea about human-centered design and how to really involve all the users along the chain of data use, data collection, analysis, and use in developing some sort of governance principle. And then also, I think our colleague mentioned this sort of idea of bridging the analog and digital worlds to not there's still a lot of paper-based collection, and while digital technology can help us, we can't sort of forget about all the paper-based systems. And then finally, I think also to add to your point about the health systems perspective, I think that we're also seeing, especially in light of COVID-19, the use of non-health data to think about health outcomes or health solutions. And I think that we don't want to lose those lessons. And so really thinking about sort of a multi-sectoral approach about around how to use non-health data, but for health outcomes would also be valuable.
Yara, I don't know if you have any thoughts on this. You're welcome to share if you do, but if not, that's fine too. We can continue with see there's a...
I was thinking beyond the data, the frameworks that are now available. So as we've seen with COVID, there are many digital health solutions that are available, but countries were struggling to select which ones, to know which ones to deploy. So one very good framework that I was thinking of is called, I think, the NICE Digital Health Evaluation Framework. And it's by NICE agency in the UK. And it looks at different factors for, first from effectiveness to cost effectiveness to things like the data governance and privacy of these solutions to then recommend and have a repository of solutions.
Yeah, thank you. Yeah, I see we have a comment here in the chat just, I think, echoing some of the earlier remarks about the need to consider diversity of local needs in countries as being important to uptake as well. So certainly an important point. I wonder if anyone has any additional comments on that in terms of maybe even process for what processes do you think would lend themselves to capturing that diversity at a local level? You know, we often think of policy processes as sort of a top-down approach, right? Where either from within a country at a national level, there's some policy framework that's adapted from maybe even another country that may or may not reflect those kind of on the ground local needs and priorities. Sometimes they even come from multilateral organizations, we know, so I don't know if you have any, maybe Juliana, even your experience is sort of perhaps a different one, but just sort of hearing about those processes to try to capture those really local needs and particularities in these policies. It'd be interesting to hear if you have examples.
So again, just reflecting on developing the IGAD regional health data sharing policy, how we are trying to ensure that local needs are reflected is, before even starting to develop the policy, we had conversations with members from members from different states. We visited cross-border sites. We talked to members from member countries, national stakeholders, and also talked to people from healthcare workers from health facilities. We also talked to a few people at the cross-border sites. So trying to make sure that their needs are actually reflected in the policy. And I think, again, having, since IGAD actually has the mandate of harmonizing policies in the region, before any policy is actually adopted in the region, all member states have to agree and for it to be adopted. So that being said, once the first draft of the policy was written, there's been a process of stakeholder consultation that has been taking place for, I think, for the last year, where we go to each and every member state, talking to, again, different people at different levels, different stakeholders from the private sector, from the public sector, from different fields across the sector, people from ICT. So just different people at different stakeholders that would actually be affected by the policy to get their feedback. Right now we are, I think, at draft 3 of the policy, which will incorporate feedback from stakeholders from the 8 member states. And also the next step after the next draft is to the next step after the next draft, once the policy will be taken to a steering committee at the IGAD level to actually have it adopted, and then again to make sure that whatever principles are in the policy and whatever roles and responsibilities and everything that is in the policy actually reflects the local needs. Members states are expected to actually adopt the policy and use the policy to basically develop their own or adapt the policy to their own contexts. So yeah, in terms of at the regional level, that's how we're trying to ensure that local needs are actually reflected in the principles and roles and responsibilities that are actually in the policy.
Yeah. We have another question coming in here in the chat. Do data sharing policies stipulate the issues around data ownership? This is given the fact that this issue is usually not well focused on by ethics committees and may jeopardize engaging local contexts. So yeah, I guess the question about where data ownership policies fit into these governance systems, and I don't know if anybody has thoughts specifically on that.
Can I come in?
Yes, please.
Yeah, just an example I could give of Uganda. We have the Ministry of ICT, which guides on the data protection policy and the law itself. However, as sectors usually go and develop sector-specific guidelines which contextualize the needs of the sector. And for health, I was lucky to participate in the development of the first draft, and we know that however much the law is a bit of open to the data for health being stored even out of the country, the sector didn't feel very comfortable with that in particular. So we had to contextualize those guidelines to fit what the health, because sectors are different. The banking sector is different, transportation is different, and everything. So contextualizing these guidelines makes sure that as a sector, like for health, where I operate, we have something that to make everyone safe, and they feel the data being collected on them is not about to be shared or to be leaked in any way. So that's why we took a bit of stringent measures, even when the policy was a bit relaxed, that you can take certain steps to store data out of the country. So I think in that regard, data ownership is more inclined to the government. So it's the Ministry of Health to allow players or they are responsible for knowing where the different players who are supporting these digital initiatives to know where they're storing the data on the citizens. But then the ownership remains solely for the government. Yeah, so that case study can help.
Interesting. Yeah, I think it is quite interesting globally to think about these issues, because as we know, some policy frameworks and country environments are moving rapidly more and more towards more decentralized sort of forms of ownership of data, you know, that almost at an individual level, that individuals, right, within the GDPR or other frameworks in many cases have a right to be left alone, to have their data deleted, to have other kinds of forms of protections put in place at an individual level, which requires, right, by necessity, requires a sort of robust system for management of those data and for soliciting of preferences and all those kinds of things, which require all sorts of technical capabilities. And it requires a kind of normative or ethical framework and a culture, right, that kind of values those things, which isn't the case all around the world, we know. So it is very interesting to hear, you know, Jamiro, in Uganda, it's sort of considered a national good, it sounds like, in many cases, data. Do others have comments on this question, this issue on data ownership and different ways of thinking about it?
If I can come in.
Yeah, please.
I really appreciate the comment from Uganda. I think this speaks to something that we see, sort of the differences between governance philosophies in different countries. You know, China, Uganda, US, Europe, they have a sort of a different idea about data ownership and privacy and security, like you said, different norms. So I certainly see them as very interlinked. I'm not sure if that answers the question from our audience member, but I would say that they're very much interlinked, especially when we think about sort of privacy and security and equity and protection.
Yeah, if I could pick up on that last point about equity, I wonder how your thoughts are on that particular principle. You know, we were covering, Juliana, I think you mentioned in the principles you would mention transparency and access and things like that, but there is maybe this even broader, higher level principle of equity that might be relevant here, and that some would argue, I think, that deployment of digital technologies for health ought to be rooted in or guided by some sort of commitment to equity. And equity in this context raises all sorts of questions, I think, about digital literacy and technology access and other issues about data access and things like that. So anyway, I wonder if anyone has thoughts about where equity fits into this policy picture, and any examples of policies that are meant to preserve those kinds of, or to address those kinds of inequities that exist within digital health systems. It's a challenging issue, I know. A lot of the time, these things are built into other aspects of digital health development processes in ways that don't really identify them as equity concerns. But I wonder sometimes if at a national level, you know, if there are any examples of efforts to focus on equity in digital health that you know, are bolstered through policy development. Yara, did you want to comment?
Yeah, I can comment not from a policy perspective, but rather from a private sector and investment perspective. So what we see in middle income countries and mainly Middle East, so Egypt, UAE, Saudi, is when you start coming up with an idea to start building a digital health solution, you try to look for the market, like the biggest market that you have. And at most of the time, this is either niche markets or the middle market, which has good digital literacy, good health literacy. And without you, this is where you see most of the solutions. But then you have the base of the pyramid is still unreachable, and this is actually increases inequalities in reach of healthcare services. Like what I've seen that has been working is UN agencies funding, like UNFPA or UNICEF or Until, the ones that I've worked with here, has been funding specific initiatives targeting like special population segments to increase access, but without having policies that would address digital health access to the base of the pyramid, and without having the whole process and special investments that would focus on this, or at least that would focus on this until they can make their ROI, then this would still be a gap.
Thanks, Yara. Let me, if there aren't other comments on that particular issue, let me turn to another chat question in the chat from Sarah Bennett. Sarah asks if Juliana or others, and perhaps Yara, I know from your work you probably touch on this issue, but if you could comment on the role of the private sector, and have private sector digital health actors lobbied for specific policies, and how welcoming are they of a stronger regulatory framework? Anyone have comments there? Sometimes we hear the private sector looking for sort of voluntary systems, right? Anyway, I'd be interested to hear, maybe Yara, if you want to start.
Yeah, I can comment on that. I think it boils down to like the return that you would get. So also within like the middle income countries where there aren't stringent regulations, this gives space for more innovation to happen, but less adoption to happen. And where you have the healthcare providers, public and private, are quite resistant to adopting digital health solutions, healthcare providers and the healthcare sector with this regard is not really lobbying for more regulations, if any regulations at all, on digital health. Who are lobbying are the digital health startups and their investors to have more regulations, but within the grander scheme of things, they have less power than the larger healthcare markets.
Thank you. Jamiro, I don't know if you have, I don't know how long you've been in the digital health space in Uganda, but I know in 2010, there was sort of an overwhelming amount of private and NGO sort of involvement in digital health, to the point where the national government actually paused all digital activities for a moment to try to respond and develop a policy framework and approval processes harmonization. And anyway, I wonder if, there's another aspect of this, which is, intense private investment by private entities and other organizations pushing to the government to develop policies. And anyway, from your experience, if you have thoughts on that.
Yeah, thank you very much. I think by that time there was a lot of innovation, which led to that disease called pilotitis, where there is a lot of piloting, but few of those initiatives go up to scale. And that's why the government felt we need to be a little bit better coordinated because of the too much duplication and unresponsive or unguided kind of innovation. But we have seen over the years that the private sector really plays great roles when it comes to innovation, but also to drive equity principles. For example, when you look at the private sector, for example, like the mobile network operators are able to reach some of those areas which initially didn't even have connectivity for digital health initiatives to operate. So the government, by partnering with mobile network operators, we have seen some of those gains. We have also seen some of the solutions, like, for example, DHIS tool that is used for national reporting works on zero rated. You don't have to pay for data bundles because of the partnership the government has with a mobile network operator. And so all the districts are able to use it on a free kind of bandwidth. So the private sector have also had good examples. For example, in the public sector, we know that most of these health systems are operating in a vertical kind of manner, whereby, and also that leads to innovations being done in that kind of approach, whereby you have an HIV system, you have a TB system, you have an RMNCH system, which sometimes leads to a bit of poor management of resources. You may find this partner is supporting HIV and they'll buy data, but that data can't be used to support a TB system due to the different mandates and the competition and everything. But we have seen in the private sector that private players who have come up with initiatives, coupling with private hospitals, have come up with integrated systems which look at this same individual, offering the services to this same individual, but in an integrated kind of format. So there are lots of lessons we can learn from the private sector, which can actually support the public sector. That some of the things which many people think are impossible are actually possible when we work well with the private sector. And there are many various examples I can give you in that regard, but yeah, they are available, and the private sector is really key in these discussions. Thank you.
Thank you. I see we have just a couple of minutes left. I don't know if anyone else would like to respond to that particular question. Juliana, I know it sounds like maybe you engaged with the private sector and you're at work, so it'd be interesting to hear what came through there.
So in regards to what the conversations we've had with the private sector, they do not necessarily want a stronger regulatory framework, but what they would like is a harmonized framework. Again, as I mentioned, the fact that different countries actually are at different levels, have different laws in regards to that data, makes it hard for the private sector, especially those with digital innovations that involve data, to be able to operate in multiple countries, because they actually have to change their methodology, their system, so as to be able to fit to abide by the laws of the countries. In the IGAD region, there are 2 countries right now that actually have laws in regards to data protection, which the 2 countries are Uganda and Kenya. And when you look at the laws at the moment, they are slightly different in regards to, like, for example, where data can be stored. I think Jamiro you actually mentioned about data storage, or yeah, so exactly, for example, where data can be stored in. I remember talking to someone who in Ethiopia, talking to a digital health innovator who found the fact that the different laws in terms of in regards to storage in Ethiopia, you actually have to store your data in the country. Any data for the Ethiopian citizens have to be stored in the country, means that the cost of actually just operating digital health systems just increases, because you're not able to operate across countries or share data or insights with other, especially if you have a company that is in more than one country. So in regards to the private sector, what they really were pushing for is harmonization, not necessarily stronger, but harmonization of data that regulation, so that it's all countries actually have the same regulation, and also there's better movement. Due to the harmonization, there should be also more better and easier movement of data within the region. So yeah.
Thank you.
Yeah.
Well, I'm being told by our organizers that we've reached the end of our session time, but let me just thank all of our panelists again for your wonderful presentations and discussion, and thank our attendees for your comments and participation. It was good to discuss this topic, and I'm looking forward to the rest of the session of the conference today. As you can see on the screen, there's if you would like to return to the main agenda and timeline, there should be a link on your screen for attendees to do so by clicking on back to agenda and timeline at the top left of your screen. And please be sure to visit the poster gallery, as well as connect with other attendees in the meeting hub. So thanks again, everyone, and we'll see you soon.
Thank you.